Statements by ministries. Minister of Health.
Well, thank you so much, Speaker. I rise in the House today to provide members with an update on our government's commitment to establish a personal support workers registry. And I am delighted to be joined in the East Members Gallery by Susan Thorning and Monica Testa-Zanin from the Ontario Community Support Association and PSW's Maureen Hilton, Roger Della Mohammed, and Alex Beekov. They are here with Doug Broadhead from my office, Speaker. Thank you. Speaker, personal support workers, or PSWs, play a crucial role in our healthcare system. They make an enormous contribution to the health and well-being of Ontarians. There are an estimated 90,000 PSWs working in Ontario. They're performing essential services for their clients. They help with daily activities such as personal hygiene and delegated health procedures like changing dressings, among others. They help people of all ages recover from illness, live with a chronic disease or disability, and live at home with independence and dignity as long as possible. 1 year ago, I committed to establishing a personal support worker registry to better recognize the work they do for Ontarians, while helping to meet the needs of the people they care for. As Yvonne Greaves, a personal support worker, said, "I feel the role personal support workers play in the healthcare system is finally being recognized in this province." I'm very happy to report that the PSW registry is now online and open for registration in Ontario. This is an important milestone in an initiative that will better help meet the needs of seniors, people with disabilities, those with complex needs, along with their families. Once the personal support workers register, employers, clients, and family caregivers will be able to confirm that their PSWs are registered. The registry will promote greater accountability and transparency and will validate the contribution of PSWs. I'd like to thank the Ontario Community Support Association and all members of the PSW Registry Steering Committee for their leadership in the development and implementation of this registry. The Steering Committee is made up of a wide range of experts, including PSW advocacy organizations, client and family advocacy groups, unions, employer associations, and educational associations, as well as several frontline PSWs. My heartfelt appreciation goes to everyone who has worked so hard to make this registry possible. We will continue to rely on their advice as we move forward with implementation of the registry. I'm pleased to say that our government has already taken a number of steps in supporting our PSWs. We invest $10 million a year to train PSWs for work in the community care sector in areas such as palliative care, acquired brain injury, and mental health. Since 2006, we've provided $27.4 million to increase the base wage of qualified PSWs and improve travel compensation, training, and other benefits. I'm very pleased that to report to the Legislature that the registry, pswregistry.org, began registering PSWs on June 1st, starting with PSWs in the home care sector. Hundreds have already registered, and by August of this year, we hope to have the majority of the 26,000 PSWs in the home care sector registered. This registry will continue to expand and will eventually include PSWs working in hospitals and long-term care homes. PSWs play a critical role in bringing our government's action plan for healthcare to life. The plan is a blueprint for healthcare transformation and addresses both the demographic and fiscal challenges that we face. A big part of the transformation involves a shift away from acute care towards a more home and community care. Our goal is to make Ontario the healthiest place in North America to grow up and grow old, and we will get there, Speaker, by focusing on wellness, by providing faster access to family care, and providing access to the right care at the right time and in the right place. For our seniors, the right place to receive care whenever possible is at home, in their community, close to their friends, their family, their neighbours. Better access to home care services allows seniors to age in dignity and with independence at home. And most of this care, Speaker, will be provided by personal support workers. We are driving real change at an accelerated pace because we simply must provide better care for an aging population while achieving better value. Last month, our government announced that we will be adding an additional 3 million hours of care by PSWs over the next 3 years, including an estimated 1 million more hours this year. We're taking strong action by choosing to freeze total compensation for our doctors so that we can afford home care for 90,000 more seniors. This investment is part of our budget's commitment to increase funding for home and community care by 4% over each of the next 3 years. That's an additional $526 million annually by 2014-15. As we implement our action plan, we know we can depend on personal support workers to provide vital services that make such a difference to the quality of life for so many Ontarians. No matter the setting in which they work, personal support workers make an enormous contribution to the health of their clients and to our entire healthcare system. I want to say a heartfelt thank you to Ontario's dedicated personal support workers for all that they do on behalf of Ontarians. And now, thanks to this registry, they're getting the recognition they so richly deserve. Thank you, Speaker.